Well, good morning and welcome to Your Mental Health, a program that is done occasionally by AARP of Maryland, which we try to explore various issues that are related to cognitive and behavioral health, meaning mental health and substance abuse issues. And today we're going to talk about some of the emotional issues that come up for many people during the holidays. Not for everybody, but for many people. And we're very fortunate to have our guest expert with us today, Dr. Rosalind Griffin, who is a clinical social worker who is licensed both in the state of Maryland and in DC. She's been in practice, I believe, for 38 years, or is it 40? It's a long time. And she spent 20 years as a professor at the University of Maryland School of Social Work. She's involved with the pro bono counseling service and various other things. She's a very generous person who makes lots of efforts to help people who need her help. So we're really very pleased, Rosalind, to have you with us today. Uh, and As I said, what we're going to try to talk about today, no, we're not going to try, we're going to accomplish it. We're going to talk about the emotional difficulties that some people have during the holidays. Some people do great, and they get into the holidays and it's just a wonderful time. But for an awful lot of people, there are things that come up. And I wonder if you could just comment on that from the standpoint of your experience with the issues that come up for people during the holidays.
My experience, well, first, thank you for that very generous and kindly introduction. The thing I notice in terms of my clients, my friends, and myself and associates, uh, the feelings can be pleasant and unpleasant as we approach the holidays. Some people are very excited uh, and expectant, while on the contrasting side, people can just find this is a very difficult time of the year. They're angry, disappointed, feeling guilty, and overwhelmed. Uh, as I think about this and from a personal standpoint and a counseling standpoint, I like to lean into myself and others being in touch with your state of mind and body uh, as we start, because that gives us a base for readiness to engage in the holidays. And some people might say confront, because that's when the stress comes up. They start to feel anxious, fearful, unhappy, overwhelmed. So if
Well, that
we are in touch with who we are, what our strengths are, when we start, we can begin to have some sense of whatever approaches, this is what I got going for me. Because
well,
our self,
let me just go back a step, Roz. You've mentioned a lot of different emotions that people experience: anger, disappointment, feeling overwhelmed, and then you added to the list beyond that that's a lot of difficult emotions for people. But I'm particularly interested in you mentioned disappointment. What's that about?
the disappointment generally is about having expectations of people and ourselves that don't come to pass. It may be expectation that, say, gifts. My finances are not where I want them to be. So I'm not able to give to people. or expectations that family members will engage with you and they don't show up. And I don't just mean physically don't show up. I mean, you expect to be embraced, cared for, appreciated, and there's no attention paid to who you are, what you contribute. So that's where the disappointment comes in a lot of times. It's not necessarily the material things, but the people we have given to don't seem, and this is my own wording, to appreciate us.
Yeah, my
That's
experience, my experience has been that in many families and for many individuals, there's been a kind of estrangement within the family, and the holidays bring up a sense of hope that we're going to be able to reconcile and to recover the sense of family and loving and caring about each other and so forth that we've hoped for, and that many people bring that into the holidays, that hope, and then the past repeats. Does that seem right to you? Is that what your sense of
well,
it?
it was some people, they think that the quote joys of the season will heal everything, and that can bring disappointment. Also, because the kind of communication or lack of communication that has created the strain frequently repeats itself during the holiday season. And even if there were a possibility of the realization of healing during this time, it sometimes gets ruptured because we are not ready to let go and put the past behind us. We need to repeat it. We come in with that person was wrong, that person was right. So yes, we can enter that way of thinking, but very seldom, in my experience, unless people have said, I'm turning over a new leaf, I'm going to listen to my family member and work that through, it can turn out being a rupture to the family gathering or the friends gathering.
Yeah, change is hard to come by. So I think many people are hopeful and then get disappointed because the past repeats, as you say. And you've also mentioned a number of sources of stress that people experience. The gifts, I find that very interesting that you talk about gifts, that, you know, there's a challenge to try to get the right gift for a person, right? And then there's also the issue of affordability. So, I mean, that's one of the practical issues that comes up. I don't know if there's anything you wanted to add about that, but you've also mentioned just getting it all together. There's a lot of stress.
Yes, the financial stress, and particularly now since we are coming out of COVID, prices are higher.
Ah,
That some individuals may have lost their jobs during this time. And just even your normal income does not necessarily meet the current prices, even with the Black Friday sales. And the other financial stress gets from the total programming of us, including me, into thinking that we must give certain kinds of popular gifts. And this is a real sense of stress for people in terms of what do I give and will it match the price of a gift that I'm going to receive?
So
So
that's going to be
that
that can be a big issue for people. But you're mentioning inflation turns my head in another direction. That's to politics. You know, inflation was a big political issue last week for the election. And there's a lot of anger within families, between people about the politics of the nation. You have any sense about that?
Are you asking me how people might manage the differing conflictual points of views or attitudes when they come together?
Well, that would have been a good question. So yes.
Uh, it's my thinking that if at all possible, that family members give some thought to what their vibes or environment wants to be like when they gather, or even if they're on Zoom, because some people are still getting together over Zoom if the family members are farther away. And think about what is the value of the individuals who are in my family or my friends, and ask yourself, do I wish to demonize, blame this person for his or her views, and control our own individual first way of speaking to the person whose views we don't share, and recognize up front we do not agree about whatever it is. Can we now talk about the things that are important to us during this season as family and friends? We can control our own response, even if we can't control the response of others, and avoid the desire to win the argument. Is it worth it? Is it worth your feelings? Is it worth what you are going to feel like, say, when you sit down to a meal? Uh, and if possible, chill.
Yeah. Yeah, a friend of mine recently went to visit her family, um, where the family has very different political views from her. So before she went, she sent an email that said, "Let's agree not to talk about certain things," and that seemed to have helped them to get through without having the huge battles. But you also remind me when you say that some people are not going to be getting together in person. We're not out of the pandemic yet, and there are issues that need to be dealt with. What people have to decide: are we going to have vaccinations? Are we going to require that? What about the anti-vaxxers in the family, and so forth? I don't know if you have any thoughts about how to deal with that.
The first thought is, do you plan to get together with people who are unvaccinated? And that should be stated very clearly. If you plan to, as a family members or as friends, know who is vaccinated and know what you want to have in terms of your own personal risk. I am a reader of Dr. Lena Wynn's column for the Washington Post. And what she has suggested is this, that people can get together who are vaccinated and unvaccinated. And if you can buy into those who are unvaccinated agreeing to having a rapid test prior to getting together, that she thinks that that will work. If those people are not willing to do that and you still wish to get together with them, rapid test yourself after the event. The feeling is, and my feeling is, that we have been isolated so long that for that brief period, you may want to take the risk unless there is somebody in the family who cannot be vaccinated for whatever health reason or is terribly vulnerable. And I've been thinking about this, and sometimes I don't know whether you went through this. You know, we had a quote unquote children's table when I grew up, when we had these large family gatherings. And maybe those people who think they are at particular risk might sit at a table away from those and do it respectfully and let the persons know who chose not to be vaccinated, say, we love you, we care about you, we also love whoever the persons there are, and we're going to sit them over on the other side of the room. Is that okay with you? It's not a condemnation of you, but it's something that we can be together and yet all be safe. It's how we talk with each other.
This is a good example, I think, of what you were saying at the beginning of our conversation about anticipating what is going to happen and preparing yourself for it. And I think when you were talking about that in the beginning, you not only meant such practical things as, and of course, this is very important. What do you do about vaccination? What do you do about political differences? But I think you were also talking about the kinds of emotional issues that come up that people can anticipate maybe and maybe deal with differently than in the past. And is that what you had in mind? And
yes, for example, I think not only because of COVID, but just the general passage of life and people who have been in our lives. Somebody who has been significant to the family and or a particular individual, sadness, grief, that empty chair, that voice of reason. And in some instances, if people are quite religious or spiritual, that person who said the grace at the family dinner. So that can bring on sadness. It's important to accept that you're sad, even as some people say his name, say her name, and say what the meaning of the gift that person had in your particular circle. So if we try to pretend that feelings do not exist and that we don't miss people, that just adds to our tension and the stress. Some family members have a tradition where they will say the names of very close family members, whether it was a recent death or whether it was a past, several years, because that is a link to their personal relationship with that person.
Interesting. We're starting to get some comments and questions, and since we only have a short time, I'm just going to interrupt what.
Okay, go right ahead.
It was. I mean, I think you're right. How we deal with memories of people that we've lost. It's very important in this. But we have this question: is avoiding family get-togethers a form of self-care, or is it not a good thing to avoid them? I mean, that's an interesting. One way of dealing with the kinds of problems that sometimes emerge in families is don't get together. What do you have any thoughts about that?
My thinking is that each person has to, number one, decide, is there a value in the connectedness with your family members? Number one. And if you value that, because part of what we're talking about is personal values and connectedness. If you are going to be under such tension while with these individuals, I say make an alternative plan. Be with people who share your practices, your thoughts, your values. That's one thing. And I see that form of self-care more of a stress reliever than whether you are endangering yourself. Because I think some of the self-care kinds of things that I'm considering in terms of dealing with tensions and anger and conflict and those kinds of things pre-existed the development of COVID.
Sure.
So what I'm saying is, how will you feel when you're present with the individuals who you think may make you uncomfortable? So there are other forms of self-care that I think we can do. I mean, we all should make sure that we're sleeping well so that when we go into these gatherings, we're not sleep deprived, that we've taken care of our health well, that we're eating reasonably, and that we seek not to go to this particular gathering to drink excessively, because these are things that, if not done well for each of us, can make gathering much more conflictual, I think, because I'm in a bad mood, I'm not sleeping well, I'm not eating well, I'm overweight, those kinds of things.
So we have only a few minutes left. There was a comment that popped up on the screen and then disappeared that had to do with, here it is. I have asked my family to refrain from political discussions during Thanksgiving. And this is a person that say, we host the holiday and I feel perfectly fine for us to politely make that request. So that's an interesting way of dealing with the possible political tensions. I just want to mention two other things, and we need to do all of this very quickly now. One is, you mentioned alcohol, and drinking too much can be a real problem during the holidays. And I think that it's something that people should think about, because alcohol has many effects on a family gathering. And I think people need to be careful about that, and I see that you agree, and you had mentioned it. The other
Yes,
thing is that
yes.
for some people, the emotions that take place during the holidays really do become overwhelming, and these are people who may want to reach out for help. Uh, and I wonder if you could comment about how people can get help if they're feeling emotionally overwhelmed during the holidays.
There are first people with insurance can reach out, and then during this period, getting therapists sometimes is more difficult. Uh, the Maryland Mental Health Association has a website that you can look for a listing of support groups that are in person as well as virtual. Those who are confronting grief, say in Baltimore City, there is Roberta's House, and it has a website where individuals can reach out, and there are remembrance ceremonies that helps uh, people go through rituals. The Gilchrist Hospice also has listings. Uh, Find your rabbi, your minister, or a trusting person who will listen. Because I think the key when we are having these experiences and feelings is you want to be heard, and you want to be felt that there is some empathy and understanding, not necessarily that the person who will engage with you can fix it, but the person is in a position where they are going to be non-critical, and they are just going to be able to sit with you and witness, if that makes any sense.
I think it makes a great deal of sense. I think you've made a great deal of sense today. I would just mention one thing, and that is that the nation now has a telephone number that you can call any place in the country, any time of the day or night, if you feel you're in a mental health crisis. That's 988. Easy to remember, 988. So people can always do that. But as you point out, for many people, the help that they can get will come not just from mental health professionals, but also from trusted people in their lives, people who can listen and who are caring. So reaching out to whether it's to a house of worship or elsewhere can be very valuable. I want to thank you for joining us today, Dr. Griffin. This has been, I think, an interesting conversation. I wish we had more time to dig into these things more deeply. But again, we're grateful that you took the time to join us and for all the thought and so forth that you've put into this. So thank you. For those of you who are tuning in, we hope you have found this a valuable program, and it's always possible to view it again. And there will be, you can go to Facebook or you can go to YouTube, and you can find this replayed. It will be there, I think, for an eternity, although that's a very long time. So we'll see. Again, Dr. Griffin, thank you very much for joining us.
I thank you very much, and I wish everybody well.